I wish I could tell you that, I don't know when your wife was diagnosed, but I was diagnosed in 2007. And I wish I could tell you that before then I would have been sitting in a meeting like this, but I would be lying because of the fact that I always thought it was going to happen to someone else. And I really didn't think about breast cancer that much because there was no breast cancer in my family, very little cancer. And at that time, I was actually working on my doctorate in nursing. And actually, before I was diagnosed with breast cancer, just 2 weeks before, I'd actually gotten my doctorate in nursing. So I always tell people I was at the top. And then I went for a mammogram, which was something that I did every year. I never, ever, ever missed a mammogram from the time I was 40. This was my 12th mammogram. But I had found a lump a few months before in November, and this was now January. I graduated in December. And I thought, when I went to see Dr. Saint Amand, I told her as I was laying there on the table, and you women know how fun that is, and she's feeling around in my breast, and I said, I have this lump here, and it must be because I'm working out in the gym, and I'm building muscles there. And she said, I don't think so. She said, we need to follow up and see. And I said, well, I just had a mammogram 6 months ago, and they said everything was fine and that there was no problem. She said, well, I think we need to do another one. So that was on January 11th, and January 12th, I had a mammogram. Then they did the ultrasound, and by January 13th, I was having surgery. And I'm going to read you what changed my life. It said, Miss Stinson is a 52-year-old woman who has a history of a mass in the right breast. At this point, we're going to do a path report and a biopsy to see what we find. 2 days later, Ms. Stinson is a 52-year-old woman who has a history of right stage 2 breast cancer. The tumor measured 2.8 centimeters in size, described as nuclear grade 3. There are areas suspicious for lymphatic vascular invasion. The tumor is ER positive, PR positive with a high K167 and a high rate of metastatic potential, and is HER2 negative. She has had a segmental mastectomy done with re-excision and sentinel lymph node biopsy. We are now waiting the results. There is a strong possibility that this patient has metastatic cancer. The risk of reoccurrence is estimated to be almost 100%, and at this point is closer to someone with probably stage 2B or stage 3 breast cancer. That was in 2007. And as I said, that changed my life. I am a different person. I never really wanted to be a poster child for breast cancer. That's not something that you really ask to do. I mean, I always wanted to be known for something, but not exactly having breast cancer. And I always, no matter where I go, I try to stay under the radar. I mean, I don't start out trying to wear my clothes backward in public. So I always try to stay under the radar, but it doesn't seem like it happened. Just a while back, my husband and I went on a cruise to celebrate his 5-year survival from prostate cancer. Because shortly after I finished treatment for breast cancer, he was diagnosed with prostate cancer. So we went on a cruise to celebrate the fact that we were both cancer-free, or at least we'd finished treatment. And I was out on the ship taking pictures of the whales, and my camera went overboard. So from then on the cruise ship, I would walk and people said, there's that lady that dropped her camera overboard. There's that lady that dropped her camera overboard. I said, yeah, that's me. So no matter where I go, I seem like I don't usually stay under the radar. So when I got breast cancer, that wasn't exactly what I was thinking about, that now I would be standing up in front of people. Because to be quite honest with you, I think when they gave me the diagnosis, they thought I was going to die right there, truly. I mean, I got very pale. And I told my husband, I said, I'm never going to have another happy day in my life. And I said, I don't think I can make it through the treatment. I don't think I can make it, no matter what happens afterwards. Because see, I'm not well, I'm a very opinionated person. I'd be lying if we've got a member of the cloth here. I probably should not lie. So I can't tell you I'm not a very opinionated person. And I probably can't even tell you I'm not very competitive, but I'm not very competitive with athletic events, and I felt like this was going to be a marathon, and I'm not very good at like that. I don't like outside events, and I don't like to sweat. And I felt like I was going to have to do both of those when I was going through treatment. But you know, I really did not think that I would make it through treatment. In fact, I went to surgery 3 times. The second time I went to surgery, they had a hard time waking me up from surgery, actually. Because, see, this was my thought. Before I went to sleep, I thought maybe if I die during surgery, then I won't have to wake up, and then I won't have to have treatment. So I was really trying to will myself to not wake up. And I didn't wake up for about 8 hours. And then when I woke up, I said, am I dead? And the nurse said, well, I hope not. I said, I'm still here. She said, yeah, you're still here. So at that point, I think that's the realization that I realized I'm going to have to do something. And I remember sitting in the doctor's office, and I don't know, there was a back of my mind that thought, I'm not going to have to do chemo. I've already had surgery 3 times. I've already had this segmental mastectomy. I'm not going to have chemotherapy. And when the doctor told me that, I think I just pretty much lost it in his office. And I remember him looking at me. He says, what's your problem? I said, well, I'm going to lose all my hair. And I'm sure he thought something was wrong with me. It's not that I thought I had beautiful hair, because I didn't. I've never had good hair. And when it came back, people always ask me, did it come back differently? No, it still came back bad. I don't have good hair. But to me, it was my hair, you know, and it was something that identified who I was. And I remember I was just crying and crying and crying. And then I remember looking up, and I saw my husband sitting there, and I saw the doctor sitting there, and the husband was bald-headed, and the doctor was bald-headed. And it kind of hit me that maybe something wasn't right here. They just told me that I might die from this, and I was going to have chemo, and I was going to have to lose my hair. But both of them had no hair, and they seemed to be functioning fine. So I started on the treatment. I did 6 months of chemotherapy. I did the 40 rounds of radiation. And this is all I can tell people, that basically what I did, I took one step every day, you know, just one step. I didn't look to the future, because in my mind, I wasn't going to make it to the future anyway. I tried to get myself in good standing with God, because I felt pretty sure I was going to be meeting my Maker. But, you know, and I remember telling people, I'm praying, but I don't hear him. And I remember someone telling me, when you're in the storm, sometimes you don't. You don't. But I knew that he was with me, because every day I got through the treatment. And I got on the other end, and that was in 2007. And so I'm here today. But what I want to tell you is that breast cancer is truly, truly an individualized disease, because people deal with it differently, and there's different types of cancer. I remember after I woke up from that surgery I told you that I had willed myself to die in, my husband about killed me, okay, because I wouldn't wake up. In fact, they kept giving me medicine to wake me up, and I wouldn't wake up. And finally they said, well, we don't know what to do. And someone mentioned one of the nurses who were very caring, and I always wish I could go back and tell that nurse, thank you. Maybe if we'll go get her husband, it'll help. And so they brought my husband in, and when I woke up, he was standing there, and I said, why are you here? And he said, well, you've been to sleep for 8 hours, and they couldn't get you awake, so you're awake. I said, I'm so hungry. I said, I am starving to death. I didn't eat breakfast, and it's been he said, okay, so they put me in the wheelchair, and they're wheeling me out, and I said, I'm starving. He said, what do you want me to do? Well, at the hospital, there was a Chick-fil-A place. And I said, I want one of those Chick-fil-A sandwiches. So he takes me in there, and he's about to kill me, because he hasn't had anything to eat either. And I'm sitting at that table, and he goes to get me a Chick-fil-A sandwich and chocolate pudding, because that's what I wanted. And I'm sitting there, and this young girl, and I found out later she's 24, her name was Chris, wheels her chair over to me. And she didn't know me, and I didn't know her. She's 24 years old, her name's Chris, and she said, do you have breast cancer? And I said, yeah, I have breast cancer. I said, I just had my biopsy, and I had the sentinel node dissection, and you know, I've got drains in, and I'm supposed to go home now. She said, well, I have breast cancer. She said, I'm 24. She said, I'm a Hurricane Katrina evacuee. She said, I evacuated here because my family lost our home, and I'm going to school. And I just found out I have cancer. She was an African-American young woman. She took off her hat. She said, see what I did? I shaved my head ahead of time, because she said, I'm not going to let cancer get the best of me. I'm ahead of it. And she shaved her hair. She said, you want me to shave yours? I said, Chris, I said, I don't think so. Yours looks good. But I'm going to keep mine a little bit longer. She said, well, you know what I think we should do? She said, I think we should schedule our treatments together. And she said, when you have a treatment, I'll have a treatment. I said, that sounds good. So we exchanged numbers, and we called back and forth. We went to our treatments together. One day she came in, and she said, Cindy, I need to talk to you. And I said, oh, Chris, we're fixing to go do our treatment. She said, they just told me my cancer has spread to my sternum. I said, I didn't know what to say. I just looked at her. I said, what do you mean? She said, but it's not going to get the best of me. She said, it's not. So she said, look, I want you to go in with me when I have my treatment today, because she said, I don't know if I can do it or not. I said, sure. You know, see, that's one of the things that you have problems with when you're a nurse and you're a patient. Sometimes you forget you're the patient and not the nurse. You know, when they got nauseated, I thought I needed to jump up and get them an emesis basin. Then I realized, oh no, I'm the bald-headed little woman sitting here. I'm the patient. Someone needs to get me an emesis basin. So I said, Chris, I'll go with you. 2 weeks later, we went for a treatment. She came in, and I noticed she was a little bit weaker. She said, Cindy, they're going to put me in the hospital. She said, I won't be here next week. That was the last time I saw her. Her family sent me a card, and they said, we want to let you know how much you meant to Chris and what a blessing you were in her life. And so I realized at some point that sometimes it's not about you. It's about other people. And so breast cancer truly is an individualized disease. And I told Regina, I said, it's more than just having parties. And it's more than just having pink. And that's what I want to get across. So, these are little ponies. How many of you ever had little ponies when you were growing up? And you know, when you put them all together, you can't tell that they're individuals. It looks like just a conglomeration. But if you separate out the ponies, you realize that everyone that is affected by breast cancer, it doesn't matter if you're a patient, or if you're a family, or if you're a husband, or a child. You know, that's something else I didn't talk about. I have 3 daughters, and I've told people this over and over again. I had a tremendous amount of guilt, which was probably irrational on my part, and still is, when I was diagnosed for breast cancer. Because the people I love the most in my life are my daughters. And I thought, what have I done to my daughters? And it definitely has affected them. It's affected how they look at life. I wish I could tell you they treat me nicer, but they don't. We still have our arguments. And I'm planning my wedding with one of my daughters right now. I can't do anything right. So we still have our problems, but they're my daughters, you know, and you only want what's best for your daughters. Not only did I put them through a year of when I was going through breast cancer treatment, but now I worry about what genes they carry because of my diagnosis. And there's nothing in the world I can do to change that, nothing, except to educate them and to help them and to be there for them. So, breast cancer has many faces, and we talked about the fact, or Norma did, that it also affects men. And you know, I've talked to my friend who's actually on the Pink Power Network, who's a male, and I said, what do you think about all the pink? He said, oh, I've gotten used to pink. Everywhere I go, there's pink. I wear pink all the time. I said, okay. So, you know, sometimes I worry about the males, because 5% of our population of breast cancer survivors and breast cancer patients are males. And usually their type of cancer is hereditary if a male has it. So cancer does have many faces. It affects young people. I remember I had a friend who was an older woman. She was in her 70s, and she would talk to me about me having breast cancer. She goes to my church. She said, but I don't have to worry about it because I'm older. And I said, oh no, that's not necessarily true. You know, it affects all of us, young and older. You know, and then there are people who get through the breast cancer treatment and then they have a secondary disease like Robin Roberts, you know, who, as you all know, she had to go through treatment now for leukemia. And I saw that too, and I've seen that too, and many of my friends now that we've been out 6 years, at least 3 of the women I went through chemotherapy with have had reoccurrences of other types of diseases. And then there's guilt there too, because then you think, why am I doing so good? You know, why? and you wonder why they've had a relapse or why they're having problems. And so there is a multitude of emotions that go through this when you become what you say a breast cancer survivor. And it doesn't matter if it's breast cancer, prostate cancer, if you've had a heart attack. You know, many of us have those types of emotions. So these are the types of breast cancer, because I'll be honest with you, I have been a nurse for almost 40 years. I was diagnosed with breast cancer in 2007. When I was diagnosed with breast cancer, I thought breast cancer was breast cancer. I didn't realize that there was different types of breast cancer. I truly didn't. Because see, when I was in nursing school, if they were talking about cancer, I learned enough to pass the test, because I learned enough to pass the test. But it wasn't exactly a subject that I wanted to study. That was for someone else. And since I've had cancer, I've learned a lot more, and I realize it truly is an individualized disease, and that there's many types of breast cancer. And that's not unusual for cancer, because that's one of the problems that we have in healing people from cancer, is that it's individualized. And so a cancer in one person's body, even if it's the same type of cancer in someone else's body, might be entirely different. It has to be treated different, and the medications might work differently, because in His infinite wisdom, God has made us all individuals and made us all different. And there is no set rule that says, when you have cancer, this is the way you're supposed to act. Or if you're a family member, this is the way you're supposed to act. There is no set rule that says, when you lose a loved one to any type of disease, this is how long you have to grieve. Because we are individuals, and we are the type of people that have that right to do that. And the guilt doesn't help that. So when we talk about the types of breast cancer, these are the types that I'm just going to share with you today. And this isn't going into whether it's ductal or invasive, but these are different types. And my cancer was estrogen positive, progesterone positive. Okay? And if you notice, the report that I read said that it was Herceptin negative. So I'm going to talk about what that means, because basically when I read that, I said, what does this mean? Main thing I saw was that there's a strong suspicion that this woman has metastatic cancer. And so when I read that, it took me a long time. You know what I did with that report? Because they gave it to me, I took it into my room and I put it way down in the bottom of the drawer. Because see, in my mind, I thought if I put it down there, then it was out of sight, out of mind, and I could forget about it. Oh, about a year later, I took it out. I looked at it and I said, ooh, that's talking about me. So maybe at this point, I need to figure out what's going on. So what does it mean when someone has estrogen, progesterone, positive breast cancer? It basically means that they have proteins on the outside surfaces of their cells that can attach to certain substances, such as hormones that circulate in the blood. Actually, if you look at it, and what you see in the research is that anyone that has estrogen, progesterone positive breast cancers, they tell us that's probably one of the better ones to have. Okay? That's probably one of the better cancers to have as far as breast cancer. And there's several reasons for that. Normal breast cells and some breast cancer cells have receptors that attach to estrogen and progesterone. People who have estrogen, progesterone cancer, it means that the estrogen feeds the cancer. Progesterone feeds the cancer. So the more estrogen you have in the body, the more progesterone you have in the body, the more the tumor grows. The bigger the tumor, the faster the tumor. So that's why it's, you know, when they say we need to watch the hormones, because if you have estrogen, progesterone cancer, then that's one of the risk factors, taking hormones. And so you have to cut that out. When I found out I had cancer, and on the same day they stopped my hormones. So, because I had been on hormone therapy for 5 years. In fact, they put me on hormones before I ever left the hospital after I had a hysterectomy. And I was on them for 5 years. I never questioned it. My doctor put me on hormones. I stayed on hormones until the day I found out I had breast cancer. Until the day they found out that my cancer was estrogen, progesterone positive. Now, with that said, we know that women who have estrogen, progesterone positive breast cancer, one of the things that they need to do is control their weight. And we'll talk about preventive strategies in January and why, but just the basis for that. because you keep estrogen in fat cells, basically. You know, I didn't realize it. Do you know you store fat cells and you store estrogen for years and years and years? I thought you just got rid of estrogen. I didn't know you stored it in your body. So if you're overweight and you have fat cells, basically what happens is you store estrogen there. So that's why women who tend to be overweight have a stronger reoccurrence of breast cancer and also have a risk factor for breast cancer. Not only that, but did you know even after you've had a hysterectomy, if you don't take hormones, your adrenal gland puts out hormones. Adrenal gland puts out estrogen. So a lot of women think just because I've had a hysterectomy or I'm not taking hormones, I don't have to worry about estrogen or progesterone. Not true. We still have it in our body. Now I know some of you are thinking I don't have as much as I need, but when you have estrogen, progesterone positive breast cancer, one of the therapies they're going to do after you have chemo and radiation is that they're going to give you medication that helps decrease that estrogen in your body. About 75% of all breast cancers are ER positive, estrogen positive, so that's what I'm telling you. That's the one that we most often see. And actually, that's the one that's had probably the most research on how to treat breast cancer. They grow, as I said, in response to the hormone estrogen. About 65% of these are also PR positive, as mine was. Mine was 100% estrogen positive and 75% progesterone positive. Women with hormone receptive positive cancers tend to have a better prognosis, are much more likely to respond to hormone therapy than women with cancer without these receptors. Now, as we go through these different cancers, I'm going to tell you which ones have not as good a prognosis and which ones have a better prognosis. All of this hinges on the fact about how early a woman is diagnosed or a man is diagnosed. It doesn't matter if you have progesterone, estrogen positive breast cancer. If you're not diagnosed early and it has spread, then you're still going to have problems. So all of these cancers hinge on how early you are diagnosed. And many people are scared. And I tell people all the time that the biggest enemy against cancer is fear. Because people are fearful when they find a lump. They're fearful if their families have cancer. They're fearful of doctors. And so, again, they're like I am. They take the path report and they put it in the bottom of the drawer and they say, I just keep going on with my life and I don't have to worry about this. But see, if it's cancer, it doesn't go away. And so no matter what type of cancer we have, if it's not diagnosed early, then it can't be treated. And I think that's the message that we have to get out, not only to ourselves, but to other people. Because they can do so much now if it's diagnosed early, and that's what's great about the mammogram screen. Now, I mentioned mine was not found with a mammogram, and there was a reason for that. I have very dense breast. And people who have very dense breasts are more at risk for breast cancer and also are more at risk for mammograms not finding it. And you usually see that in young women, which I thought must be pretty good. I mean, I'm an old woman and I have very dense breasts. I must be good. And then I figured out it's not so good because my mammogram, what the doctors told me, probably missed it for 5 years before I was actually diagnosed. So cancer had been growing in my body for 5 years before it was actually diagnosed. So those women who have dense breast, it doesn't matter if it's estrogen, progesterone, or what type of cancer it is, the recommendations now, and we're seeing it more and more, and we've seen it in the last 6 or 7 years, is that women with dense breasts should be offered an ultrasound or an MRI. So hopefully we're going to start seeing that more. Hopefully insurance companies are getting the news. Hopefully physicians are doing that more for women who have very dense breast. Now, as I said, if you have estrogen, progesterone positive breast cancer, then if you're before menopause, after you finish, they're going to put you on tamoxifen. If it's after menopause, they're going to put you on what we call the aromatase inhibitors. They do not block estrogen production by the ovaries, but they can block other tissues from making this hormone. And that's why they give that to women. Basically, if your cancer is negative, estrogen negative, progesterone negative, they will not put you on these medications. Have you ever wondered why some women get the medication, some women don't? That's because theirs is negative and the hormones aren't going to help them. So only women that are going to get these medications are going to be women who are estrogen positive, progesterone positive. If their cancer is negative, then these medications will not help them. And that's why I say this is a better type of cancer to have, because see, not only can you take chemo, but you can take radiation and you can take these medications, which will help you. They told us that we need to take the medication for 5 years. And I'm not going to tell you they don't have side effects. They do. They do cause weight gain. Some women have tremendous amount of joint pain. So they actually say only about 35% of women finish the 5-year treatment. Many women just stop. It's kind of like high blood pressure medicine. You've got side effects, you don't tell your doctor, you just stop taking it. So I actually did take the medicine for 5 years. I did have some of the side effects. And then when I finished at 5 years, now they're telling us that the new research coming out says women should probably be taking it for 10 years. So that's one of the new standards that's probably going to be coming out, that now they're recommending that even women that have taken tamoxifen for 5 years take it for 5 more years, and that people who are taking these aromatase inhibitors take it for 10 years. So I asked my doctor about taking it for 10 years, and she just looked at me. She said, well, there's not enough research yet. I said, well, it's coming out. She said, well, when it gets really out there, then we'll decide. But it wouldn't help me because I only took it for 5 years. I didn't do real good with 5 years, so I was kind of glad that they were going to give it to me for 10 years. I mentioned tamoxifen. And the way that tamoxifen works, that's different from the other medications, that it blocks the tumor's ability to use estrogen. So those medications actually work in 2 different ways. The 3 drugs that you hear most about as far as the aromatase inhibitors are going to be the Arimidex, the Femera, and then the Aromasin, okay? And currently, this is what I think is so great, because we have so much research money that's put into breast cancer now because of different groups that have really worked with breast cancer, Susan Komen, some of the other groups, that breast cancer gets so much more research money than other cancers. And to me, it's really, really sad, because then I go back to thinking, okay, well, I had breast cancer. I'm one of the luckier ones. What if I had pancreatic cancer? They don't put a lot of money into pancreatic cancer. Very, very little money. Ovarian cancer, another one. Very, very little money is put into research for ovarian. Lung cancer. Lung cancer kills more people than breast cancer, prostate cancer, and colon cancer combined every year. Very little money is put into lung cancer. There actually is a disparity there, because people think people who have lung cancer, well, they just need to quit smoking. People are judgmental. And that's not the real reason. When you think about lung cancer, there's other reasons for lung cancer too, although that is one of the main reasons. But you know, any of you ever have bad habits? It's not as easy to quit a bad habit as you think it is. Sometimes it's very difficult. And so, as I said, we're lucky with breast cancer. I've learned over the years that breast cancer is one of those that there is a lot of research. There's a lot of people that care about people who have breast cancer. We get a lot of support. And so currently, though, there is clinical trials underway for a vaccine to either prevent or slow down the growth of estrogen, progesterone positive breast cancer, which makes me feel very happy, especially for my 3 daughters and my 3 grandsons. And I'm still waiting for 2 of my daughters to have children, and I wish they'd hurry up and do it. You know, I'm waiting. Of course, one of them needs to get married first, but then she can have kids. Okay, the next type of breast cancer, triple negative breast cancer. Now, what is triple negative when people are diagnosed with that? And I hope this, what it does, explain to you a little bit why treatments are like what they are. When someone has triple negative breast cancer, it means that it's progesterone negative, estrogen negative, and Herceptin positive. I mean, Herceptin 2 negative, or HER2 negative. About 10 to 17% of all breast cancers are triple negative. This cancer has a poorer prognosis than other types of breast cancer. There's several reasons for that. It's usually a hereditary type of cancer. It is usually carried on that BRCA1. Angelina Jolie, who had mastectomy, she had BRCA1. Her mother actually had triple negative breast cancer. These cancers generally respond well to chemotherapy. However, they have a poor prognosis than other types of breast cancer because we have no targeted therapies for them, such as tamoxifen or Herceptin, to prevent a reoccurrence in women with triple negative breast cancer. So in these women, even if they have a very early stage of this cancer, stage 1, most likely they will have chemotherapy and radiation. So if you have a friend or someone who said, you know, I have triple negative breast cancer, but they said I'm gonna have to have chemo and radiation. The reason is because we don't have any medication to give them for 5 years to help prevent that cancer from reoccurring. So what they're gonna try to do right from the very beginning, they're going to do everything they can to prevent a reoccurrence of this breast cancer. I'm reading a great book. It's a Pulitzer Prize winner book. It's actually an autobiography of cancer, believe it or not. The name of it is The Emperor of All Maladies. But what it talks about in there is the mistakes that we made early on with triple negative breast cancer, because they would just do a mastectomy and no chemo or radiation, and then they would have these reoccurrence. And it took researchers and doctors a while to figure out the reason that you were having the reoccurrence is because you couldn't give them tamoxifen, or you couldn't give them Herceptin, or you couldn't give them any of the aromatase inhibitors. So that's why these women will probably even very early stage breast cancer. Now the progesterone, estrogen positive breast cancer, they may not have to have chemo or radiation if it's stage 1. All cancer centers and research centers have protocols that they follow, and most of the protocols are based on what type of cancer and what the slides show. In a recent genetic study, researchers found that 1 in 5 African American women with breast cancer have an inherited mutation in at least one of the 18 genes that are linked with a higher risk of breast cancer. In African American women who have breast cancer, it's usually the triple negative breast cancer, which researchers now realize that even when these women have been diagnosed at the same time, it's one of the reasons why they have a stronger reoccurrence of breast cancer and also a higher mortality rate. Compared to the general population, African American women are more likely to be diagnosed with breast cancer at a younger age. Triple negative breast cancer is usually at a younger age than estrogen or progesterone positive. Die from the disease and have triple negative breast cancer. This type of cancer is more likely to affect young people, my friend Chris, African American, Hispanics, and those with the BRCA1 gene mutation. And researchers have suspected for a long time that these differences are due to inherited genes linked to breast cancer, but this is the first study to look at all known breast cancer gene mutations and not just the BRCA gene. So I've mentioned the BRCA, and I've talked about it in previous presentations, and probably not all of you have gone to those, so I'd like to explain what those are because it's actually in the news a lot, and you might wonder what that is. Well, BRCA1 mutation, and what that really means is breast cancer antigen mutation. There's actually 2 that have been found, the BRCA1 and BRCA2. These 2 genes, if you have that mutation on those 2 genes, then it increases your risk of different types of cancer. Now, this is where you have to be real careful here because these are the only 2 gene mutations that have been discovered that leads to different types of cancer. It doesn't mean that they are the only ones. And the reason that I say that is because I hear so many people say, oh, I've been tested for BRCA1, BRCA2, you know, I have breast cancer and I don't have the gene, so my family's all right. Not necessarily true, because there are other types of mutations in the genes that carry cancer, and we just don't know what they are. So if someone has a BRCA1 mutation, which Angelina Jolie did, it's a gene or chromosome 17 that normally helps to suppress cell growth, the BRCA1. But if you have that mutation, then it means that you don't suppress cell growth, which means that cells can grow very, very, very quickly, including cancer cells. So if you have a mutated BRCA1 gene, it means you're at risk and your family's more at risk for breast, ovarian, and prostate cancer. There's been some estimates that say that people that have this mutation on this gene, chromosome 17, have almost a 50% chance of having breast, ovarian, or prostate cancer. And then there's a BRCA2 mutation. BRCA2 is a gene on chromosome 13 that normally helps to suppress cell growth. If you have a mutation on that gene, then you have a higher risk of getting breast, ovarian, or prostate cancer. And let me just mention here, because a lot of people don't realize that if you have breast cancer in your family, then if you're looking at your family tree, then it also puts your family at risk for having ovarian and colon cancer. And I say that because it's very, very important for people who have breast cancers in their families to be screened for colon cancer. You know, the one reason that we do so well with breast and colon cancer and finding it early is that we do have ways to screen for it. And people tell me all the time who have breast cancer, where I don't want to go be screened for colon cancer because, one, somebody's going to be looking at my backside, and two, you have to drink that stuff. And you know, I have a friend who is a nurse practitioner, and she says, Cindy, you know, not too many people die from the PrEP, but they do die from colon cancer. And she said, and then I have a friend that actually works back in gastroenterology, and she went to high school with us too, Debbie. And she tells me they don't really look at, you know, they keep you covered up, so they really don't know who it is. And people don't realize, this is a wives' tale too, that sometimes people don't realize. They think that only women carry these genes, but it can be carried on the men's side too. See, in my family, my maternal grandmother had ovarian cancer, which now I'm looking at it. She was 81, though. And then my mother died at 65 from a heart attack. So I always thought I was going to have a heart attack. So I've been kind of watching out for that. And they tell me my heart's great. And so I never expected to have breast cancer. Now, on my husband's side, though, he has prostate cancer. His mother had breast cancer. So she was diagnosed at 63. Which is kind of different too, because I was always really, really close to my mother-in-law. I mean, like, my husband and I started dating at a very young age, so I was really close to my mother-in-law. And of course, she's dead now, but I often talk to her and I say, you know, I was really close to you, but I didn't really want what you had, you know? So it's kind of strange. I don't have what my mom had, but I have what my mother-in-law had. And I got to see her, how they dealt with breast cancer for her, and the difference is how they deal with it now for me. And there has been a lot of difference. She didn't have chemo, and she actually had mastectomy at 63. She had another one at 73 because she had breast cancer in that side, and then she actually died from colon cancer. So my thought is probably what happened is that the cancer was in her body all along, and because she didn't have chemo, it probably spread. Breast cancer happens to be a little slower growing cancer than other types of cancer. I'm not saying that they're all slow growing, but like I said, when my cancer was discovered, it was 2.8 centimeters. Below 2 centimeters is usually considered stage 1 breast cancer. It usually grows a half a centimeter a year. Breast cancer does, a half a centimeter a year. By the time mine was discovered, that's why they estimated it had been growing at least 5 years or more, because it was 2.8 centimeters. And as far as I know, I didn't have any bone metastasis. One of the things that continue to worry with me is microcalcification in the bones. But it's been 7 years, so. And you know, none of us know what tomorrow holds. That's one of the things I've come to realize too, at least with breast cancer and colon cancer and so, we have a chance to live. And we have a chance to fight. And people who go out here and we have a car accident, they don't get that chance. And that's another thing they told me too, you know, when I was just upset. And another thing that I learned to be really thankful for is that I had insurance. I could pay for my treatment. I had a car to get to treatment. I had family that loved me and was willing to support me. I had a phone where I could call the doctor. I had a job to go back to. The people that I worked with, and Dr. Rivers is here, works with me, took over my work schedule so that I could do chemo. And they held on to my job for me so I could go back. But I have met women through the years that don't have insurance, don't have a car, don't have a phone, don't have family, and don't have a job to go back to. Not only that, they have young children at home that need to be taken care of. So I truly had a lot to be thankful for. And so many times with this BRCA mutation, people who have that, a lot of times their cancer comes on earlier. It's a cancer of young women, such as my friend Chris that I talked about earlier. So mine was Herceptin 2 negative. Up until just a few years ago, people who had Herceptin positive breast cancer, it was almost a death sentence. But about 15, 20 years ago, there was a young doctor, and you can see this movie actually on Lifetime, and I don't know the name of it, it's a great movie, but it talks about his trials and tribulations and trying to get a trial set up with women in order to give them medication to stop the growth of Herceptin positive breast cancer. And he went through all kinds of trials and tribulations and was actually able to put 15 women together who were in a trial. And actually, even though they knew that, this book that I'm reading is really great, but even though they knew that they were dying, were willing to do a trial of a medication to help other women. And you see that so much when you look at the history of breast cancer, how many people were so brave that went before someone like me that has allowed me to live because they were willing to do clinical trials and they were willing to do what needed to be done. And some of those clinical trials worked. In this case, the women that were on the HER2 trial, actually 4 of the women who were told they weren't going to make it got through the trial, and they're actually still alive today. They're actually motivational speakers, and they go around and they talk about the trials and tribulations of being on a clinical trial and when people didn't think that it was going to work. So because of what he was willing to do and what these women were willing to do, they got it approved through the FDA, and now this is standardized treatment. And this is one of the cancers that we say have one of the better prognosis now as far as breast cancer. It's Herceptin positive breast cancer, and usually what happens here is that the women will get the chemo or the radiation if they need it, and then they will get this medication for a year afterwards, and it's usually one dose like once a month that they have to do for 6 months to a year after their chemo and radiation. But again, it's given us some more ammunition to fight the reoccurrence of breast cancer. Again, it goes back to the fact, though, it has to be diagnosed early. So about 1 in 4 breast cancers, or 25%, have too much of a growth-promoting protein called HER2/neu. It's often shortened to HER2, and it's referred to as HER2 positive. These women have too many copies of the HER2 gene, resulting in greater than normal amounts of that protein. And these cancers tend to grow and spread more aggressively than other breast cancers. And that's why I said before we had the medication to give them, there wasn't much we could do to help these women because it didn't always respond to chemo. It didn't always respond to radiation. So Herceptin is the drug that you sometimes hear about that some women have to take at your church or wherever your friends, and you might wonder why are they getting it, but this woman over here is getting tamoxifen, and that's why, because these women have Herceptin positive breast cancer. Then we have inflammatory breast cancer. This is one type of cancer that we can't really pick up on a mammogram. And so women have mammograms, but it will not pick up inflammatory breast cancer. The problem with this breast cancer is that many times it's misdiagnosed by the healthcare professionals, and it's misdiagnosed by women themselves. Many times women will think that they just have mastitis, which is an inflammation of the breast. Especially this type of breast cancer tends to show up after a woman has been pregnant, usually when she's breastfeeding. Many times she's usually a young woman, and at diagnosis, now you remember mine was 2B. At diagnosis, these women are usually staged at 3B or 4. Okay, so it's usually an advanced cancer when it's finally diagnosed. And basically what you see in this type of breast cancer, which is different than the other cancers we've talked about, is that the women's breasts have a lot of edema. It's called peau d'orange, actually, P-E-A-U-D-O-R-A-N-G-E. And their how do you pronounce it, Faye? My French. Yes. and their breast looks like an orange. You know how an orange is sometimes pitted? Okay, that's what it looks like. And it has extreme redness, but it's not going to show up anything usually on a mammogram. The clinical appearance is due to plugging of the lymphatics, which keeps the breast from draining any type of fluid. So the breast is very sore, very inflamed, and has a lot of edema. It is rare, and that's one of the reasons we have problems diagnosing it, because people don't look for it. You know, women don't look for it, the doctors don't look for it, and nurses don't look for it. It's very aggressive. We don't know what causes it. It has usually a poor outcome because of the fact it's diagnosed later. And the median overall survival among women with inflammatory breast cancer is usually less than 4 years. And it was described for the first time in 1814. So it's not it's been around. So women who have inflammatory breast cancer, by the time they're diagnosed, they usually have positive lymph nodes. You know, in my diagnosis, and also you see it here, it says they have a high tumor grade. Whenever you see that in a path report or hear it, that means that the tumor is dividing and growing very fast when it has a high tumor grade. That's not necessarily bad, because what they know is that when it has a high tumor grade, it usually responds better to chemotherapy than if it has a low tumor grade. But if it has a high tumor grade, it means that it's growing very, very quickly, and we need to try to take care of it. They're usually progesterone, estrogen negative, so the medication that I talked about that helps is not going to help. And for some reason, this type of cancer is increasing 4.35% every year. So we're seeing it every year. We're seeing more types of this cancer. Really not sure why. One of the reasons researchers are looking at has to do with environmental influences. You know, what we're eating, what's in the food that we're eating, even if we're eating healthy, what's in the food we're eating, how many hormones are in the food that we're eating. And so that's one of the things they're looking at. Inflammatory breast cancer is higher in black women than among white women. And among women who have inflammatory breast cancer, the median age varied by racial group, ranging from 49.5 years in American Indian to 54 years in blacks and 58 years old in whites. So American Indian, Alaskan Natives who have this appear to get it at a younger age. For women overall, the median age was 57 years for inflammatory breast cancer, where with women with other types of breast cancer, estrogen positive, Herceptin, they usually don't have, the average age is 61.9 years. So the reason I'm telling you that statistics is to let you know that inflammatory breast cancer women will have this earlier. With the other types of cancer, especially estrogen, progesterone positive, it usually shows up later. Although I was 52 when I was diagnosed, so. And that's what I was saying, which to me is both tragic, but I think it's interesting. I think it's going to have something to do with the etiology of inflammatory breast, because it says a surprising portion of young women with inflammatory breast cancer had their first symptoms during pregnancy or lactation, which leads me to believe it has something to do with hormones, even though it's usually negative, hormonal. And there's a misconception that young women are at lower risk for breast cancer, and the fact that inflammatory breast cancer is the most aggressive form of breast cancer may result in metastasis already present when the diagnosis is made. You can see how it'd be misdiagnosed in a woman that's breastfeeding. So, the people, this is one that's related to being overweight. The highest BMI, and really 26.65 is probably average. I mean, below 25 is considered normal weight. So 26.65 is not considered very overweight. But having a higher BMI is associated with having inflammatory breast cancer. So again, being overweight might be one of the reasons why we're seeing more inflammatory breast cancer, because we have more people that are overweight, and we have more young people who are overweight. And it was interesting when I was looking at research, blood type A has been associated with more generally with an increased cancer risk. Not just inflammatory breast cancer, but just cancer people who have type A blood type. And it does occur in men, but usually at an older age than in women. So the diagnosis for inflammatory breast cancer is usually based on a doctor or nurse's examination. The mammogram is not going to really be able to show it. And then they're going to do a biopsy, ultrasound, and mammogram to confirm the diagnosis. Usually what you see on the mammogram is not going to be any type of lump, because there's usually not. You're just going to have a skin thickening. And dermatologists need to know about this, because many times the women or the men will go to the dermatologist thinking they have a rash, and it's inflammatory breast cancer. And most dermatologists aren't that familiar with doing breast exams and looking for breast cancer. So this is a clinical presentation for inflammatory breast cancer. A sudden increase in breast cancer, little or no response to antibiotic treatment, because sometimes the doctor will give them for mastitis. They say if you've been on antibiotics for 2 weeks and you don't have any decrease, then they need to send them to a specialist. And it should be considered in women who are pregnant or breastfeeding comes in with these symptoms, because breast infection is less common in women who are not pregnant or breastfeeding, even rarer in women after menopause. So if you see what looks like an infection in a woman that's past menopause or one who's not pregnant, then you need to suspect inflammatory breast cancer. This is some of the pictures of what inflammatory breast cancer looks like. Just to give you an idea. It looks very painful, doesn't it? But you can see the red, you can see that peau d'orange appearance. And the last one that I wanted to talk about that I thought many of you probably had not heard of, or was one that we're seeing more often too. It's called Phyllodes tumor. It's a type of breast cancer that's very rare, and it actually can be benign or malignant. Their name is after the Greek word phylloden, which means leaf, because they're leaf-shaped growth pattern. And these type of tumors feel like smooth or smooth-sided or bumpy, not spiky like we usually with most breast tumors that are cancer. And so many times they're mistaken as just fibrocystic type of disease and not breast cancer. It's more common in women who have benign breast lumps called fibroadenomas, or people who have fibrocystic disease. You're going to see this type of tumor. And in the area where the tumor is, the skin may be warm to the touch. It may be red in lighter skinned women. You can see that. It grows very fast. It's a very fast growing type of tumor. And again, it can either be benign or not malignant. And this is how they stage it. You know, with regular breast cancer, it's stage 1 to stage 4. With this type of tumor, they either stage it as benign, malignant, or in between. That's how they stage it. Most women who have this are young women. They have not gone through menopause. The earliest age that it's been diagnosed is in a young girl who was 12 years old. Okay? It's usually found near microcalcifications, which is something I haven't talked about because we're not really talking about diagnosis. But anytime you have a mammogram and you read on it that there's calcification, that means that there's growth going on. Not all microcalcifications in the breast are malignant. And radiologists are trained to look at those calcifications and look at which ones are malignant and not, and then decide, is this a pre-malignant type of microcalcification such as DIC, or is it a tumor growth? But these type of tumors tend to be and start growing next to any type of microcalcification, which is different. Usually can't get a clear diagnosis on this, so usually they have to do an open surgical biopsy. As I said, most breast cancers are classified from stages 1 to 4, but this isn't the case with these types of tumors. Classified as benign, borderline, or malignant. Most of these tumors turn out to be benign, but there is a group of them that are malignant. And the difference with these types of cancers, if you know anyone that ever has this, chemotherapy doesn't seem to work. The only thing that you can do in these types of tumors is surgery. and there's a very strong chance of reoccurrence. I liked this picture because I really believe for myself and many women who have breast cancers, you know, the slide on the first said that not all rainbows are lollipops and roses, but all raindrops have a little bit of a rainbow, and I really believe that. And when I saw that picture of that little girl, I thought, you know, that's kind of neat, because a lot of times we have to work a little harder to have the rainbow.